Hello, everyone. My name is Marta, and I am hosting today a webinar about egg freezing. And I am today with our fertility expert, our main clinician, Dr. Nair. I can see Dr. Nair. Hello, Dr. Nair. How are you? I can see that people are start joining, so maybe we will give like a minute for everybody to kind of log in because we've just started. So just for all of you to know, today's topic is fertility, and this is a Fertility 101. So this means that we will be talking about everything related to fertility. So please, we presented sort of like some questions, answers, some slides to visualize everything. But if there are any topics that you would like to cover, there is any extra questions, there will be a time at the end. So please, you can already start submitting. We have like options, QA questions, because this is a rare opportunity. You have our doctor here, and she's obviously our fertility specialist. So before I will start, Dr. Nair, to discuss those topics, just for people who perhaps don't know who we are, London Egg Bank is the specialized clinic of London Women Clinic, who is only like specializing in egg freezing and egg donation. So we have more like the largest experience is this. We told more than 13,000 eggs so far and frozen more than 35,000 frozen eggs. And yeah, and I will perhaps now start with the questions. Is this okay? So I can start with our slides. So screen. So let's start with the slideshow. Can you see, Dr. Nair, the slides?
Yes, yes, yes.
Okay, I just need to start the slideshow. Okay, so I will then leave it to you. So Fertility 101, here what you should know about fertility. We did the introduction of London Egg Bank already. We can skip that. Dr. Nair, female fertility.
Well, this is just a kind of, I don't know how many of you may have some idea about anatomy. You may remember your days back in school, but this is just to give you an idea about the female reproductive system. So you have the womb, the uterus, the neck of the womb, the cervix, and then attached to the womb are these two the fallopian tubes, which are, flexible muscular tubes with finger-like processes at the end. And this is the ovary, where the egg is, a mature egg is produced and released every month. So when normal conception happens, the egg is released by the ovary. It's thrown out actually into that space behind the uterus. They call that the pouch of Douglas, picked up by the tube. And it's inside the tube that the sperm and the egg meet. Fertilization happens inside the tube. And the fallopian tube is actually the home of the embryo, the fertilized egg, for the first few days of its life. And then that embryo moves into the womb and gets attached to the lining, the endometrium, and then becomes an ongoing pregnancy. And of course, the rest of pregnancy, then the womb, of course, responds to the pregnancy. So the sperm is deposited, of course, in the vagina and then travels into that tube to fertilize the egg within the tube. So this is just a brief view of female fertility. one of the commonest reasons why when we see couples with problems regarding fertility, could be block or damage to the fallopian tube, could be hormone imbalances, polycystic ovaries, or conditions related to the ovary. There could be endometriosis, where you have bits of the lining of the womb lying outside, which can lead to heavy, painful periods. There could also be pathology within the womb, like fibroids or septum, polyps, that can reduce the chance of pregnancy. So when we investigate, these are the main, in the initial assessment that we do if someone presents with infertility.
Okay.
And a little bit here of what happens during those 28 days typical cycle. And here you can see what happens within the ovary. So the egg matures in a sac called a follicle. A follicle is a fluid-filled sac in which an egg matures. It's very tiny at the start of the cycle. And as that follicle gets bigger, the egg matures inside it. And it is, when it gets to that around day 14, day 12, day 13, day 14, a mature follicle releases the egg and then changes into what we call a corpus luteum, which then, if pregnant, would then support the pregnancy for the first 3 months of its life. And as that follicle grows in size, it produces estrogen, and that's what you see up on the slide above. The estrogen goes up, peaks around ovulation time, and then comes down, but then continues to rise if pregnant. The progesterone, which you see as the pink part, is the test that most GPs do to test whether someone is ovulating. Starts to rise about 2 days after ovulation. And if pregnancy does not happen, those hormone levels fall and the lining shakes.
And this follicular development, Dr. Nair, is this how the egg grows in the follicle?
Yes. So that little tiny thing, little cell that you see is the egg, and that matures in a sac called a follicle. When we scan, or monitor someone, we cannot see an egg. What we look at is a follicle of this sac called, which contains fluid, appears black on the ultrasound, and again, the follicle ruptures when it is mature to release the egg. And this is the egg now that is being released by that follicle, hopefully to be picked up by the fallopian tube. And inside the tube, if someone is, of course, trying to baby, one hope, but the egg hopefully will fertilize within the tube.
Okay. And so Dr. Nair, I don't know if many people realize, so there is normally only like 5 days that a woman is fertile. So when the egg...
It's like, no, the sperm actually survives for a long time. It could survive for about 5 days in the cervical mucus. So someone trying to avoid a pregnancy, the follicular phase, you can get, someone can get, unplanned pregnancy if they can use contraception during that time. The egg survives for a shorter time, more like 2 to 3 days. And therefore, if the egg is not fertilized after it's thrown out into the pouch of Douglas or the space behind the womb, it would degenerate. So that, of course, when we advise couples who are trying for a baby, we talk about regular sex, 2 or 3 days a week, rather than targeted sex, because the sperm, the male factor, sperm function is also better when couples have regular sex rather than abstain and aim for this fertile days. So, it's obviously better to not focus on a few days a month if someone is trying naturally, but just have regular sex throughout. It also adds less pressure when someone is trying for a pregnancy.
So Dr. Nair, just like a question, I thought, so normally every woman every month will have only one this follicle growing and then one egg released. Is there ever happening that there will be two eggs?
Yes, yes, you can have, twin pregnancies do happen naturally, as you know, in 1 in 80 cases. I think it's 1 in 80, and even less frequently is triplets. So yes, you can get twin pregnancy that can happen naturally, of course. So sometimes two eggs can be released when you get non-identical twinning, but that would be exceptional. The standard, the rule, or the more usual pattern is to release one egg.
And we have two ovaries, women. So why is only one egg?
Well, I think nature wants to prevent a litter. We nurture our children much longer, so we are not like one of the lesser creatures evolutionarily, and therefore yes. So one aims for that's the way that fertility is planned. One pregnancy being the favored.
Okay.
Yeah.
So the best egg sort of from both ovaries.
But yeah, when we look at the studies, it shows, ovulation can happen either from the right or left ovary. Now, many studies suggest that there's a 60% chance of ovulation on the right ovary, 40% from the left side. But it really doesn't matter because the egg is thrown into that space behind the hoop and it's picked up. So when, say, women have had an ectopic pregnancy and one tube is removed, the tube from the ovary from the tube that is removed could still produce an egg which is then picked up by the other tube. Although, it might be
more difficult.
Yes, slightly more.
Okay, that's very interesting. And now, age and fertility.
I suppose this is as they call it, the elephant in the room. We're all aging, that's part of life to age. But yes, for women, that age has a bigger impact on equality than on men. So we have a short reproductive life. And both the number of eggs remaining goes down. You can see that happens actually the number of eggs start declining even before a girl child is born. So the maximum number of eggs that a girl child has is while she is still in her mother's womb. So the aging process the number of eggs start to decline. But of course, it starts declining more significantly after that 37 and then further 41 and 45. So you see the decline with age. But of course, remember, whether you have many eggs remaining or fewer eggs remaining, you only produce one egg every month. This number of eggs is more important for women looking at, say, egg freezing or IVF, not so much to do with natural conception.
I understand. So Dr. Nair, because 1 million, there's quite a lot of eggs when we are born. So where they are stored?
They are tiny primordial cells in the ovaries. They are little tiny, which you can only see under the microscope. So the egg, matures again. We mentioned about that follicle on the earlier scan. But most of the stages of these so-called follicles are microscopic, and you can only see them under the microscope. But it's only when they get to a certain stage, what we call the antral follicular stage, the stage where we look at, the scan, where we look at ovarian reserve, we'll come to that later, that you can see them on the scan. So yes, and even menopausal ovaries will have a few eggs remaining, except they're atretic, they're not longer going to mature, they don't release eggs. So you can, under the microscope, see these tiny atretic eggs, but they don't lead to a pregnancy.
Okay, I understand. Thank you. Age and egg quality.
I think in a way, this probably is more important when it comes to natural conception. Egg number is probably a little bit more important when it comes to egg freezing. And simply the equality is the ability of one egg, not many eggs, but one egg to make a healthy child. And as women grow older, because unlike men, men produce sperm every 3 months, there is a cycle of spermatogenesis where new sperm is added, and therefore the impact of age on the DNA of the sperm is less sharp than on the egg. So as the egg ages, the DNA, the nuclear material becomes more fragile, more likely to fragment. And therefore, when that egg fertilizes, there's a high chance of abnormal chromosomes. And that is what leads to miscarriages. Of course, it can also lead to situations like Down syndrome. And also overall, it reduces the chance of pregnancy. And I suppose this is what most women who are trying naturally would be anxious about, because egg quality starts to decline around 36 years and gets a little sharper after 38 and further after 40 and beyond. And this reduces the chance of natural conception. It increases the time to pregnancy. So women who are older take longer to get pregnant. Many do get pregnant, but it could take longer. And also the risk of miscarriage and Downs also goes up with age.
Okay, and so there is nothing we can change this, I'm afraid. Anything with the diet, exercise?
A healthy lifestyle is important for fertility, as it is for so many other parts of being healthy. You can't reverse the effect of age, of course, but you can reverse or avoid other environmental factors like smoking, or heavy drinking or drugs.
Okay.
Which can also affect egg quality.
So would it be just for the cycle when you prepare this one egg to mature, or you can actually impact the whole reserve you have?
No, ovarian reserve, and the number of eggs, that is not the quality, can also go down in women with history of smoking, or they've had previous surgery, chemotherapy, radiotherapy, or family history of premature menopause. Yeah, certainly. But the egg quality, of course, is reversible. It takes about 3 months for any change in the lifestyle to have an impact on egg quality. Now, there is no way you can measure egg quality. So
just our observation.
There's no test for egg quality. So we can say this is what might be, what you could, that there's no blood test or scan test or any test to give us information about egg quality. The only test for egg quality is a pregnancy. So if someone is pregnant, well, that's obviously a good test of someone's fertility. But short of pregnancy, one has to go all the way through IVF. When we actually collect those eggs and fertilize them in the laboratory, generate what we call fertilized eggs or embryos, and then grade them. And that gives us some idea about the egg quality. So we have no test for egg quality.
Okay, and for example, if I am a woman and let's say I am thinking in a year to try to get pregnant, so I can already start to have like a healthy lifestyle and things to increase my chances.
Yes. So starting preconception, vitamins, reducing alcohols, not to smoking, getting the BMI down. So getting to that optimal BMI, if possible, closer to say 22, 24, 25, would all make sense. And then reducing overall stress.
Okay, that's good to know. And yeah, so this is another study.
Yeah, I think this is basically saying that when we look at the human, the human species, we're not as fertile as rats or mice, and therefore it is important, of course, to talk about a year rather than a month. And you can see that the success rates, so many women do get pregnant even older, of course, they do, except that time to pregnancy may get longer. But certainly as one gets to that 40 plus, the chance of pregnancy and this, because again, a healthy child or healthy, of goes down significantly. But you can see, of course, the younger you are, the faster you're likely, the time to pregnancy would be shorter, and you're likely to be far more fertile.
Mm-hmm. So for 40, 44, what will be on average like chances for conception? Because here it only takes that if it takes 3 months longer, see your doctor, but on average?
I think as you get to 42, plus, the chance of getting pregnant in a year would be about 10 to 15%.
Okay, and slightly higher 40, 42.
Yeah, and then so rather than so when you look at younger women, 85% chance of getting pregnant within a year. And you can see that sharp decline that happens after 30. So as you get to 42, you're probably getting it. And that, of course, is presuming that the partner's sperm is normal, the tubes are functioning normally.
Okay.
There is no other pathology, like the womb is healthy, no fibroids, etc. This is only talking about the effect of age. That is the egg quality.
But does the effect of the age also impact like womb or other things? Because you mentioned fibroids.
The womb does not. Yeah, the womb is not affected by age, which is why donor eggs. So we have a breastfeeding program where we treat women up to 54 years, and even menopausal women have the same chance of getting pregnant using donor eggs. So age doesn't affect the womb; it affects the eggs.
Okay. So, what are the ways of measuring your fertility?
So, as I said, we do have limitations, and ultimately, there is no fertility is quite gray. There are very, very few tests where we can tell someone they're 100% fertile, or the other way around. So these tests that we do give us some information. They tell us part of the story, not the full story, but it's a good way to start. So of course, a scan, a pelvic ultrasound scan is one of the first tests we do. And so we're looking at two things when it comes to a scan. We're again looking for pathology, any evidence of fibroids or collection of fluid, or a tube that is dilated with fluid and abnormal, so therefore unlikely to be damaged. Any in the ovaries, whether a cyst, endometriotic cysts, or other types of cysts. A pathology, which could be risky. Sometimes we have found that very rarely on a chance scan. And then beyond that, we look at how active the ovaries are. We count those little sacs that we mentioned earlier. And along with the AMH, they tell us about what we call the ovarian reserve. Now, again, have you got a slide about ovarian reserve, Martha?
Yes.
Yeah, okay. So we can, so what does it mean, ovarian reserve? So ovaries have the ability to respond to stimulation by producing a number of eggs.
I think, Dr. Nair, I'm so sorry. I think the best slides, we will need to a little bit maybe go, because I don't have ovarian reserve, but
no, just go back to the previous one. No, just go back to the AMH, that's fine.
Okay.
Yeah, this one. This is fine. So this is one important hormone test that we do when women come to us for what we call fertility MOT. It's a test of ovarian reserve. Like the scan gives us some information, but this is also a very sensitive marker. And it's simply the ability, it's a marker that predicts how many eggs we are likely to get with a certain dose of stimulation when someone goes through treatment. So it's not a test of natural fertility. It's not a test of egg quality. It doesn't tell us what someone's chances are when they're trying to get pregnant. But they're very useful when we're looking at women who are looking at egg freezing or going through IVF. Or to give us some idea whether one is getting, say, to the perimenopausal period, or there's premature ovarian failure or polycystic ovaries. Now, of course, these are markers that predict they're not 100% accurate, but they predict how many eggs we are likely to get. It's important when it comes to egg freezing. It is important when it comes to IVF because these markers have some statistical advantage. So when we get more eggs from one cycle, that cycle is more likely to be successful. So these are markers, they go down, ovarian reserve declines with age. Again, not everyone ages the same way. So these are the first 2 tests we do when someone is kind of looking at that initial kind of getting an idea about what is the timeline, how much time do they have. Now, it doesn't, again, it's not a crystal ball that can predict the future, but it tells you where you are now at this point of time. And it is part, not the full, but part of the biological clock. So marker, yeah, I can answer any question later, but this is basically the scan and what we call the anterior follicular count are the 2 markers that we use to predict how someone may respond to stimulation when someone is going through either egg freezing or IVF. And if you look at, yes, someone has mentioned what is the range. Now in the UK, we tend to use picomoles per liter. So there is a calculation, nanograms per mil. Someone will have to do that Google for me. But if you look at the AMH, there's a kind of quite a wide range that is normal. And there's quite a large overlap between the different ages. So it's not A to B, C to D. So we go with what is we call the 50th centile. What is the average? So for women below 36 years, 15 picomoles per liter is average. So if someone's had these tests before.
So and this test for how long is kind of reliable?
It's black and white. Of course, if you're younger, you're not like this test is not likely to change, dramatically. So say someone in their 30s, it should at least be valid for a year.
Okay.
Because it may be shorter if you're getting to 42, 43, because it's how the aging, it goes down with age. And not everyone doesn't age exactly the same way.
And so if I, for example, check my AMH, let's say I am 36, I see my AMH is like 20. So can I relax a little bit, thinking I have a little bit more time about having children or not?
Once again, I've come back to the fact that this is not a test of your natural fertility. It's not a test of equality. But what it would tell you is that if you are looking to delay pregnancy by, say, a year or 2, because you're in that cusp when the equality and numbers start to decline, it will be a good time to, of course, if you're trying naturally, a good time to start sooner rather than later. But if you're looking to delay and your AMH is good, then it's possibly very good to look at egg freezing, because it's possible that you will produce, quite a number of eggs, and your chance of getting a good outcome from egg freezing would be higher.
But could it tell me that if this age I have this high AMH, that perhaps my menopause will come a bit later and my ovarian reserve is still okay?
Well, no, actually, no. It's not a crystal ball that can predict the future. So it's not a marker of menopause, although of course with women who are menopausal or perimenopausal, the AMH would be very low.
Okay, so once I do the test, I can say, but by doing the test, I cannot predict whether my menopause.
So these markers are they're not useful to predict, and because it's not for many women who are looking to plan a family. There's only so much you can predict. But what you can see is what are your options now.
Okay. So I can check on today time.
Yeah.
But it's quite important because I said there's so many this AMH providers now. You can even order AMH in Boots, Superdrugs, other. And it's also important, I think, for people to understand how they can interpret this, because often those providers will not give interpretation of those markets. So the person might think, oh, my AMH is high, I'm highly fertile, I don't need to think about anything, which is actually not after talking to you and explaining this, that makes more sense for people to kind of know what to expect from the test.
Exactly, and there have been many studies that have shown, shown that the chance of getting pregnant naturally with low AMH is just as good as with high AMH, as long as the periods are regular.
Okay.
So this is not a marker of natural fertility.
Okay, perfect. So, egg freezing. So what is this egg freezing, Dr. Nair?
So again, we talked about follicles. Now, so these are the sacs called follicles in which eggs mature. This is, of course, a follicle that has grown it's quite large. And this is the kind of size
here. Mm-hmm.
Yeah, this is a scan picture, a vaginal ultrasound scan showing the ovary. And within the ovary, these sacs called follicles. And this is not, of course, an ovary that is what you would expect if someone walks through the door. This is an ovary that has been stimulated, and it's just before what we call egg collection. So these should contain a number of mature eggs. Because when we actually collect the eggs, we put a needle from below through the vagina into the ovary, aspirate the fluid from all these follicles, and then examine the fluid under the microscope for eggs. So you can't see this egg itself, but you can see the egg will be floating in the fluid. And then it's mature eggs then that we freeze. So eggs that are mature are frozen.
Okay, so and what advice would you give to someone? How many eggs they should have to have some sort of like a guarantee, more or less, that they have some realistic chances of the pregnancy or live birth in the future?
Yeah, and again, that depends again on the age. It depends on the age of the egg. So we know from our egg donor, we've got a lot of data from frozen donor eggs. So if someone has, say, 20 eggs, I think there is an 80% chance of a live birth. And the minimum would be about 6 to 8 eggs, with 12 to 14 being a good number. But that is for women below 36 years. As one gets older, we'll probably need more eggs. Now, of course, the technique, vitrification, the technique we use to freeze eggs, is relatively young. So the data from older women is a bit more limited compared with younger eggs, because we have a donor egg program that's quite large, and we have a lot of data from young eggs. So what we know at the present time is that at least in the younger group, frozen eggs and fresh eggs give us comparable pregnancy rate. So not every egg on one cycle will lead to a baby. So we expect, say, 70 to 80% of eggs that we collect to result in an embryo, and about 50% of those embryos getting to the stage where we take them to in the lab, the blastocyst stage, before we put them back, which are embryos that have developed to a stage where they're just before they're likely to implant. So not every egg is destined to make a baby on every cycle, which is why we talk about numbers. We don't need 6 eggs to make one baby, or 10 eggs to make one baby. But the success rates are higher when we get a few more eggs on one cycle. So
Dr. Nair, the kind of, I went back to this. So you would say if somebody coming for the egg freezing with their eggs frozen or fresh, the chances of getting pregnant will be kind of the same.
No, not really.
As the age when they are freezing.
No, this is purely over 1 year. This graph will not apply to egg freezing. But because when you look at egg freezing, you're talking about not 1 year, but one treatment cycle at a time.
Yeah.
You're talking about going through as one cycle and then looking at your chance of, statistically, chance of having a baby later. Through frozen, through fertilized. So of course those eggs have to be fertilized in the lab. When when one is ready to have a baby, and then we take them to that blastocyst stage. All this has to happen in the laboratory. So with young women, we have a 50% chance of clinical pregnancy per embryo transfer. So, which is why if we have 3 embryos, that's a good number. You know, you've got a 50% chance of a clinical pregnancy per embryo transfer. So if someone has 20 eggs and maybe five or 6 blastocysts, that would give up to 80% chance of a live birth. And once again, we don't have just to check the quality, and therefore this is looking at statistics, just looking at 100 cycles that happened before. We wouldn't be in a way talking about one person's personalized chance, because we don't have any test for equality.
So, and on average, how many eggs can someone expect to store in the one cycle, egg freezing cycle?
Yeah, so if someone has a good ovarian reserve and is say 32, 33 or 34, you could expect about 12 to 14 eggs on one cycle. With some producing fewer, and of course, if someone has above average ovarian reserve, they could produce 20 eggs, 20 mature eggs. It's not uncommon in women with high reserve or with our egg donors. Some of egg donors with high ovarian reserve do that too. But again, every cycle can be different, because ultimately it's not natural to produce 2 eggs or 10 eggs. We are manipulating the body to do what is not natural. And with that, some degree of unpredictability is expected. So we're not machines doing exactly the same, and 2 cycles can be different. So this is just to give you an idea, not to say precisely this is what you could expect.
Okay. And why would you say egg freezing works?
Well, as we said before, it's the eggs that age, not the womb. Of course, the body ages, so someone getting pregnant older will have to take the age effect for the risk during pregnancy, but not the chance of getting pregnant. And therefore, you're buying time. You're buying time if you freeze eggs, because if you freeze eggs, say when you're 32, but use them when you're 42, your chance of getting pregnant and miscarriage and downs would all depend on the age when the eggs were frozen, not when the eggs were used. So that gives women, after I suppose the pill, the next biggest option to take control of fertility, their own fertility, because one cannot, 20s, 30s, many women are not yet ready to start a family, but may not want to lose the opportunity to have their own biological child when they are older.
And how about you have already a woman, let's say in her 40s, and she's coming to you? Would you advise her doing egg freezing?
No, I wouldn't, because I think as you get older, it's all to do with the cost and the statistics. And, we don't have much data in women who are older. Certainly in women above 43, egg freezing probably would give an extremely low chance of getting pregnant. And 40, 42, one could consider egg freezing if the AMH is high. But one has to be cautious about the expectations, because again, the success rates could be much lower, like less than 10% has been if you have 6 or 8 eggs. So if you've got 20 or 30 eggs, that would give a chance, but many women at that age don't produce that many, or may have to go through many cycles. So one has to be very careful when looking at egg freezing above the age of 42 or 43. But short of that, I think possibly the group that benefits the most would be women in their 30s. But as you get to 40, you can, if you're early 40, 41, 42, with a degree of caution.
Okay, but if you will have a situation that, let's say, things happened in life, this lady just now realized that she's not ready, let's say she's 42-year-old, and of course, knowing all these facts, do you think
Yeah, I think
beneficial, or it's better to like kind of give up?
Well, that is a highly personalized decision that everyone would have to make. After all, this is a choice, not a medical. We all age. Age is not a disease, but it will depend a lot on that AMH, on that ovarian reserve. Certainly, if one is likely to produce 2 or 3 eggs, or the reserve is low, then one would want to discourage someone going through multiple cycles of egg freezing, because what you don't want to, obviously, you're putting your body through treatment. There's cost, physical, financial, emotional cost. And then there is statistics at the other end. But it doesn't mean that someone who says, look, I want to freeze my eggs, I know what my, you've been given the information, you're making an informed decision, and they want to do it. Well, of course, so many women do that. We wouldn't say no to egg freezing at 40 or 42, as long as we explain.
Yeah, sometimes I guess if money is not the problem, sometimes some chance is better than no chance.
Yeah, it's all to do with, it's a very personalized decision, and I think many women may, in the same situation, may make very different decisions. And I think all of them would be right, because what's right for one person may not be right for somebody else.
Yeah.
So it can't be just one rule for all, I think.
No, I think it's important to know what to expect. And then make this decision knowing all the facts that is the best for you, and sort of know what to expect, because I think the worst is coming after using those eggs and then being, for example, disappointed.
Today the HFE allows women to freeze for up to 55 years. So it's a long time, that eggs can be kept frozen, which is a great thing, because it means even younger women can start freezing eggs.
Yeah. But it was not an option before. It's only like now that become available. But I guess, yeah. But you do IVF for women up to what age?
45.
45. So why not egg freezing till 45?
I mean, I think it's a question of, again, we don't have data. So, it doesn't mean that you just have to exert even more caution after 42 years, because as eggs age, they do become more fragile. And at the moment, we don't have data. So 43 is kind of, because after 44, 45 with fresh eggs, the chance of pregnancy per cycle is less than 5%.
How about
after 45, we haven't had any live births, which is why we have a cutoff of 45 years.
So would it be better, Dr. Nair, to freeze embryos when somebody is kind of like 42, 43, like if they don't have a partner, use donor sperm or something, so they know what they have in the story?
I think these are very difficult decisions, Martha, to make easily, because selecting donor sperm or deciding on donor sperm itself is a major decision. I think that would have to be discussed at the consultation and would have to be highly individualized.
So I think this is the slide also visualizing what you said. And
yeah, saying that from 10 eggs, you could expect 2 to 3 blastocysts. Or I think we get more than 2 at the moment. Our data from younger eggs is probably higher.
4.
But it's just saying that there is natural attrition, that not every egg will get there, and not every embryo will be a baby.
So, ecto, just to explain what is it?
So when eggs are frozen, and so if you look at an egg, it's a relatively large cell. It's surrounded by these tiny cells. We call those tiny cells cumulus cells. So before the eggs are frozen, the cells around the egg are dissected away. The eggs are laid bare, and we can legally only fertilize mature eggs. So when later on those eggs are thawed, one would have to inject 1 sperm into 1 egg. We call that ICSI, to fertilize those eggs. And then once the eggs are fertilized, they are cultured again. We mentioned it earlier, to that blastocyst stage, and then replaced inside the lining of the womb. This is simple, like a smear test. for the embryo to implant.
Okay, so it's not painful, doesn't need sedation, not like
no, it's just like a smear test, really. It's a very simple procedure.
Okay. And yeah, so this is kind of like next step, obviously, for someone who is interested to kind of get to know a little bit your chances as of now, how Dr. Nair explained. We have for all the participants some offers for the fertility health check. But obviously we will email you after. But now, Dr. Nair, if that will be okay, there are some questions submitted to answer. Let me bring myself. So we have first the question from first person. Hello. I will not say the name. My question is about that I am diagnosed with hyperthyroidism and I am 51. I would like to know about the risk and if I can have a healthy IVF treatment.
You can have a healthy treatment. You can have treatment using donor eggs, of course. Hypothyroidism is quite easily treated with thyroxine tablets. They are safe during pregnancy. If the womb is healthy and there's no other medical cause, that could risk your life when you're pregnant, then there's no particular reason why you cannot try treatment using donor eggs. The success rates depend on the age of the eggs, not your age. So it gives you a good chance when you use young eggs. We have additional tests, of course, for women above 50, including, mammogram, ECG, generally physical health checks, just to make sure that the risks during pregnancy are kept to the minimum.
And so this is hypothyroidism, and the other type of thyroid is hyper.
Hyper is more common and much more easy to treat.
Okay, so then also wouldn't be an issue.
Yeah, so much.
Another question: does the hormonal stimulation for egg freezing causes any type of difficulties for natural pregnancy later on?
No, because this is a 1 month treatment. I just want to come back to what we mentioned, those little antral follicles, which we see every month at the start of the cycle. So at the beginning of the cycle, one would see quite a few of these little tiny sacs. And only one of them is destined to grow. One egg, as we said before, is destined to be released and the others die away. So nature wastes eggs every month. And what egg freezing does is to rescue some of those eggs that would normally have been lost. So if someone takes a pill, for example, for 25 years and has not ovulated for 25 years, they will still hit the menopause when they were destined to. Equally, rescuing those eggs is just a 1 month treatment. It doesn't have any impact on subsequent cycles.
I hope that that answer. And another question: does abortion impact fertility? Could there have been damage that was undetected at the time of abortion that affect fertility?
Let me answer that question, because if you had abortion impact, only if it damages the tubes or if someone has scraped the lining vigorously that you damage the lining, but not otherwise.
So because there are two types of abortion, how about this early abortion that you use only like a pill? Would that have any impact?
That would not affect at all. It's
so only the surgical ones, if somebody do some harm to the internal organ, but then you know that.
Sometimes it's incomplete and there's infection and it can damage the tubes.
But would the person know it after the abortions that there are some complications?
Yeah, if they've had infection, they would know. But if the lining is thin, you wouldn't know unless you do a scan.
Okay. So by the scan, you can... Sorry, I'm cutting you. It's hard when there is a recording because it's like cutting the time difference. I just wanted to ask, so if this lady would like to see that, she can come for the scan, and on the scan, you will be able to tell her whether there are some scarring or something that could affect her fertility.
No, we can't. It's a screening test. A scan can tell us if the lining is healthy. Many of these screening tests are more useful if the test is normal. So if you see a normal scan, that's very reassuring. If the lining is thin or is looking, irregular, then further investigations up to like a hysteroscopy may be needed.
Okay, so then you will determine that and discuss, but there is options to check. Yeah. Hello, I have an HPV at the moment. Is it still safe for me to extract and freeze eggs this year, or shall I wait? And another part of the question is, what would be a healthy range? Oh, this is other question. So let's firstly answer the first one.
Yeah, HPV is fine for egg freezing. Of course, there's no risk of going through egg freezing if someone is waiting to have a colposcopy, or there's no disadvantage in doing that.
Okay, so this shouldn't affect that this eggs frozen will have like a virus or something, will be unhealthy with the child or anything.
No, this is purely the cervix, the neck of the womb.
Okay. And another question from this lady, part of it is, what would be the healthy range of AMH for 34, 35-year-olds?
Anything above 15 picomoles per liter would be good.
Okay. And thank you, Liliana, for lovely messages. And I have also Dr. Nair, because I think we finished all the live questions, but some people submitted like one question that we haven't like answered yet. I'm just going through this because I have a list. Polycystic ovarian syndrome. So there were ladies asking if they've been diagnosed with polycystic ovarian syndrome, could they still go ahead with egg freezing, or?
Definitely, yes. There are protocols that we would tailor based on how severe the polycystic ovaries might be. But most women with PCO do quite well with egg freezing.
Would this be also a good options for them? Because if they have problems with ovulating.
Well, no, if there are problems with ovulation, then one would just give them tablets to induce ovulation, so that they ovulate if they're trying naturally. But talking about fertility preservation, women with PCO usually, they do respond quite well. And the vast majority may get quite a number of eggs. So it might give them, one cycle might give them enough eggs to give them a decent insurance for the future.
Okay. And another question, can the length of my cycle affect my fertility?
In the sense that someone ovulating every 28 days would ovulate about 14 times a year. If someone is ovulating, say, once every 32 days, then you may ovulate maybe 10 times a year. And therefore, the time to pregnancy may take longer.
Okay.
The normal, interval there is between, so say someone between 20, so the average interval is 28 days, with 21 to 35 being within the normal range. So if someone is ovulating or having periods once every 6 weeks, then there's a good chance that they are not ovulating and may need help.
Okay, so then this would be sort of like possibly abnormal. It's better.
They may need help to induce ovulation.
And how about these people that they have spotting between periods, or like?
No, mid-cycle spotting is not abnormal.
And
can happen at the time of ovulation. Because one has to make sure there's no pathology like cervix, so there could be pathology like even cancer, which can lead to irregular bleeding. So it's good to have a checkup, have a smear done. But having, regular mid-cycle spotting is not by itself a problem.
Okay. Another question, there is a lady, she's 38 years old, and her AMH is 1.8. She's worried and asking if she still have a chance to get pregnant with IVF or naturally.
Well, naturally, as I said, the AMH is not a factor. So as long as the periods are regular, the chance of getting pregnant with low AMH or high AMH or normal AMH is the same as any 38-year-old. With IVF, the statistics, AMH is quite low. So if you get 1 or 2 or 3 eggs, that would have an impact on the success rates. It depends on, and it's good in these situations to do another hormone test, FSH, LH, and E2. It's a test to check how much of estrogen the ovaries are producing on day 2 or day 3 of the period. So the AMH can be done at any time, but these tests have to be done at the start of the cycle. And they are useful to give an idea about whether the ovary will respond to stimulation by producing more than one egg. And therefore, that would have an impact on the success rates. So if someone is unlikely to respond, then one may have to kind of take a step back from IVF or stimulation.
Mm-hmm. Another question from the lady that asked before, could an abortion have weakened the cervix? Is there a way to check cervix strength?
No, you can't check the cervix strength in a non-pregnant uterus, but an abortion can sometimes lead to damage to the neck of the womb, and which leads to a higher risk of losing pregnancy during the mid-trimester, that is after 3 months. So there are scans that can be done during pregnancy to measure the cervical length, and a stitch can be put. So that can, you can avoid.
Okay. So once the lady is pregnant, she can go for a scan, and they can like strengthen the cervix.
Yeah, so most obstetricians know what to do, and therefore there will be need for extra monitoring during pregnancy.
Okay, that is, and the last question, I have a very unusual question. One person is asking, from your experience working with different patients, what was the most common reason why some ladies wanted to freeze their eggs?
It's because they haven't found the right partner.
Okay.
Many of them. I think many women, of course, when they come, they talk about, using contraception and avoiding a pregnancy, as being the overriding kind of concern. And then suddenly when you hit the 30s and you haven't met the partner you want to have a family with, then you're kind of looking at, the future.
Preserving the chances when you have that person. Okay, so generally it was more sort of like, have this option after.
Exactly. It remains an option. It may not be the magic answer for every situation. And not every woman would want to do egg freezing, even if they have the option. But this is today with vitrification and the technology having taken us where we are, this is a good option, especially for younger women.
Okay. Thank you so much, Dr. Nair, for all the questions. And I hope we have some comments that the session was informative and helpful. Thank you so much, Roxana. That was the idea, because I think there's so many misinformation and about fertility, and this should be information that all of us know, because it's our body. So thank you, Dr. Nair, for talking to us, and for all participants. Again, we will contact you tomorrow with some offer if some of you are interested to do fertility health check. But I hope that whether you would like or not, you get some valuable information from today's session, and thank you again for being with us this evening. Bye.
Thank you very much.